This week, your baby is about the size of a squash, and you may be experiencing some sleeplessness. As well, you may be experiencing some pain on the side of your baby bump because your belly is beginning to expand. You'll also be having some other conditions that make you extremely uncomfortable, like a bleedy gum, and they are all normal. Hi there, my name is Jovita and this is week 29. So if you're 29 weeks pregnant, congratulations. I'm glad to have you around. And this is a woman-based channel, which is a research-based channel. If this is what you've been looking for, because we'll be sharing a lot of tips on other areas apart from pregnancy, you might want to stick around so you be a member of the family. So without further ado, let's get right into the video. As a 29 weeks pregnant woman, you need to ask yourself a few questions that will help you in the course of this journey. Number one, how is your baby's position at 29 weeks? Your baby is beginning to change positions and moving around as frequently as possible at 29 weeks. And this also means that it is possible for your baby to be in a breached position. So over the coming weeks, your baby will continue to change positions in preparation for the day of birth. Now, another question is, what are the risks of having a baby at 29 weeks? If a baby is born pre-birth at 29 weeks, the baby might have an inability to maintain body temperature. This is something that we should already know, and that's the reason why you have incubators helping the baby to maintain a particular, more like a simulator, to help maintain the womb's temperature for the baby as the baby continues to mature or develop into the 9th month. Within this period, your baby will be having breathing problems, and that's the reason why you have all the plugs, the wires attached to the baby so the baby can have its respiratory functions in a controlled environment. So this is something that is normal. You can't just keep a baby in the incubator without supporting the baby on breathing, and that's the area of the doctor. But just for us to know the reason why we have such arrangements made for babies to survive in the incubator. The baby could also develop anemia or a low blood cell. You know, in week 28, we talked about 10% health or long-term health challenges. Now, this is the 10% long-term health challenge that a baby can encounter if the baby is born at, say, 28 weeks or 29 weeks of pregnancy. So number 3, what pains should you be expecting at 29 weeks pregnant? If your baby is pressing against your bladder, that means you'll be using the toilet or the bathroom as often as possible, meaning you want to urinate like almost all the time. Secondly, the bigger your baby is, the more uncomfortable you'll be. And these are mild changes or mild pains that you'll be encountering. Thirdly, your baby has developed the habit of throwing himself or herself around. You know, now is the time to go about the gymnastics. The baby is now very, very active, and that can make you to sleep less. It's not actually painful, but it can be very discomforting. And just when you're about to sleep, you may suddenly begin to have leg cramps. So how can I prevent preterm labor at week 29? How can you prevent preterm labor at week 29? Well, research has it that vaginal progesterone is as effective as cervical sacrilege in preventing preterm labor. This medication does not require surgery or any kind of anesthesia. So just visit your doctor and your doctor will handle the condition. Your doctor might decide to give you a medication other than or as an alternative to the cervical sacrilege. So that'll be all for now. For a recap, we have asked questions about how the baby is positioned at 29 weeks of pregnancy. We have asked about preterm labor at 29 weeks of pregnancy. We've talked about how to prevent preterm labor at 29 weeks of pregnancy. And we have talked about some discomforts that we can be able to handle at 29 weeks of pregnancy. And that's about that. So if this has helped you in any way, Don't forget to give this video a thumbs up, share, like, and subscribe if you're yet to be in this family. There are more to come in future. This is just the pregnancy section of this channel, and we have a lot of things in store for the future. See you in the next one as we look forward to week 30. Bye-bye.